I get to an email now from a viewer named John. He wrote, "My name is John Seeley. I am an emergency room nurse and I am begging you to help us. Over the past week, we have seen an exponential rise in patients coming to the emergency department for minor symptoms of COVID or people just coming for a COVID test." He went on, he said the healthcare systems are almost to a breaking point in the Portland metro area and we need everyone's help. Understand that all, not just minor COVID symptom patients, are waiting multiple hours to be seen by a physician because of this increased strain. Healthcare staff are stretched thin and frustrated. He added, "You called us healthcare heroes a year ago. We are asking the community to be our heroes now and help us out." Wow. John, thank you so much for your email and again for the work that you're doing in the emergency room. Our staff was actually so struck by what John wrote and what he's seeing now that we reached out to him to talk more about it. Here's what he said.
Spreading like wildfire right now. And so I would say over the last week, we've seen an exponential rise in just COVID cases in the area. That doesn't necessarily mean that they're all extremely sick. It's just a lot of people that either need tests for school or travel or just a peace of mind are coming into the emergency department to get tests because they can't get into an urgent care because they're maxed out or they can't find a test at their local pharmacy store.
Other healthcare workers we talked to were really glad that somebody brought that up because they say they're seeing the exact same thing.
Right now, the situation you would find in a Portland ER is a very long wait of potentially 10 hours or more isn't uncommon. I heard of a 16-hour wait just this week, particularly if you are coming after hours. So if you have mild symptoms, please go get a COVID test and then talk to your local healthcare provider about potential treatment options or how you can isolate at home and potentially treat your symptoms.
Now, they each wanted to emphasize if you have a true emergency, that's when you go to the emergency room. Absolutely do that. Your life is in danger. If that's the case, it's still the best place to go and they can still treat you there. But if you have minor symptoms or if you can't find a COVID test, it is best to go somewhere else.
If you're having symptoms, a lot of people are experiencing mild to moderate cold symptoms. So quite honestly, if you don't feel very sick and you feel like you just have a cold, it may be worth getting testing. But again, that alone may not necessarily warrant going to the emergency room.
Now, the Oregon Health Authority announced today they will be creating a case support hotline for you to call if you test positive for COVID, but you don't need urgent medical care. We'll let you know when that hotline is up and running. Now, the OHA also today put out guidelines telling hospitals how they should act if the time comes to begin having to ration care. KGW's Pat Doris joins me here to talk about that. Pat?
Well, Maggie, it's kind of chilling to think that they need to do this, but the fact is that even though Omicron gives a milder case for a lot of people of the coronavirus, that there'll be enough people, because it's going to be a huge swath of folks getting infected, there'll be enough in that small category that get very, very sick that the hospitals could be overrun. It could be a huge problem. They're estimating as many as 1,600 people into the hospitals, and that's about 500 more than was at the height of the big surge that we had in September. So a lot of folks are very concerned about that.
Yeah, understandably so. Can you tell us more about, these guidelines and how they would help if that situation does come to fruition?
Well, and we want to be clear that we're not there yet. This is just sort of in case. But if a hospital is full and all the hospitals are full and there's no place to send other patients, and for example, they don't have enough ventilators, they don't have enough ICU beds, this sets up a procedure where they will go in and rank the different patients that need this highest level of care. And there's a number of different medical objectives that they'll use to analyze people so that hopefully you take, the race base and economics and everything out of it, and it's just purely a medical decision. And people will get a number, and the lower the number, the better, because that means that you have the highest likelihood of surviving your hospital stay, which is really the metric that they're looking at. Who's going to make it and who's not. And for the people that are having a higher number, they may not get that ventilator. They may be denied. The care may be rationed. And it'll be a brutal decision, but it's one that they think they may need to make in a few weeks. We'll see. Hopefully not, but that's why they're doing this.
I know we've talked about this with doctors before, and they've always explained it as they try to give the care to those who will benefit the most, not those who deserve it the most. All right, Pat Doris with that update for us. Pat, thank you for the info.